Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I know your symptoms?
Well, I'm getting frequent nausea and vomiting with an aspiration pneumonia and abdominal discomfort. I had an endoscopy which revealed a small ulcer after dropping my hematocrit. Now I feel anemic. I had a CT scan last week that revealed nematodes, SIS, and my cecum is worrisome for ischemic colitis, bilateral hydronephrosis, and multiple liver lesions. Yesterday, I had multiple bowel movements and passing flatus and had epigastric pain.
Okay, what's your age?
I'm 67, doctor.
Do you smoke or have any other harmful habits?
I have a history of chronic alcohol use, but I've stopped smoking long back.
Tell me about your past medical history.
I have chronic obstructive pulmonary disease, a history of pneumonia and aspiration, osteoporosis, alcoholism, and microcytic anemia.
Well, your physical examination shows you are afebrile. Your heart rate is in the hundreds to 120s at times with atrial fibrillation. Respiratory rate is 17 to 20. Blood pressure is in the 130s to 150s and 60s to 70s. Your abdomen is distended with tenderness, mainly in the upper abdomen, but very difficult to localize. The CT scan shows pneumatosis in the cecum, with an enlarged cecum filled with stool and air fluid levels with chronically dilated small bowel. There is a possibility of ischemic colitis with possible metastatic disease, bilateral hydronephrosis, atrial fibrillation, aspiration pneumonia, chronic alcohol abuse, acute renal failure, chronic obstructive pulmonary disease, anemia with gastric ulcer. I would recommend getting a repeat CT scan to assess it further to see if there's worsening pneumatosis versus resolution. To further evaluate the liver lesions and make decisions regarding planning at that time. Since you have frequent desaturations secondary to your aspiration pneumonia, any surgical procedure or any surgical intervention would certainly require intubation, which would then necessitate long-term ventilator care. So I will look at your CT scan and make decisions based on the findings.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Tell me about your problem.
I am having severe and recurrent jaw pain. There's also numbness, tingling along the jaw, teeth, and tongue.
How long have you had these problems?
For the past 6 months, I even consulted a dentist, but the dental evaluations are normal. I was also diagnosed with a throat infection last week, and I was prescribed Avalox, which I have almost completed. I am taking cough drops and trying to increase fluids.
Oh, I see. Do you drink or smoke?
No, doctor, but I used to chew tobacco for about 30 years, but I've recently stopped.
Okay.
Moreover, I've also lost the sensation of taste. The numbness is on the left lateral tongue and jaw that extends from the angle of the jaw to my lip doctor. Recently, I've gained about 20 pounds of weight, and that may be due to decreased activity.
Do you get headaches?
Yes, doctor, about twice in a month.
Do you experience any fever or chills?
No, doctor.
Do you have any tooth pain, especially while biting?
No, doctor.
Have you had any jaw popping?
No, doctor.
Any spasm of the jaw that is trismus?
No, doctor. I've stopped chewing tobacco, and I'm using Nicorette gum now, doctor.
Okay, what's your age now?
50 years.
Have you ever had any surgery?
Yes, pertinent for hernia repair surgery.
What medications are you taking at the moment?
And I'm on Nicorette gum.
Are you allergic to any medicine?
Yes, I'm allergic to codeine. I used to feel dizzy or lightheaded when I took codeine.
Your blood pressure is 138/82. Pulse 64, normal temperature 98.3, and your weight is 191 pounds. Your oral cavity is normal with good moisture. You have a slightly decreased sensation to your left jaw that extends to the left lateral tongue and left intriguing mucosa. The fiber optic nasopharyngeal escapee reveals a moderately deviated nasal septum. To the left, large inferior terminates. You have developed persistent paresthesia of the left manual teeth. Tongue possibly neoplasm within the mandible. You have also developed hypoglycemia with loss of taste and dry mouth syndrome called xerostomia. I would suggest you have a CT of your head, including sinuses and mandible, so that I can evaluate and make sure you have not developed neoplasm. Take plenty of fluids and come and see me again when you get your diagnosis reports.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hi, I'm having a critical issue with my computer.
Let's troubleshoot. Who's your usual support technician?
It's Ms. Harper.
You said it's critical. Is your computer not booting?
Yeah, it's the computer Ms. Harper upgraded last week.
Well, she's not available today, I'm afraid, but there's a free slot this afternoon with her colleague, Mr. Jensen.
That would be okay. But are you saying Ms. Harper could fix it tomorrow?
That's right. She could attend to you first thing. Can you wait?
Well, I'm not using that computer, and I've moved to a backup, which is helping. The problem started when I was installing a software, so I'm worried I might have disrupted Ms. Harper's work. It makes sense for her to check it out.
Okay, we'll book you in for tomorrow morning at
Now look at question 26.
Now, you'll have received the survey asking your opinion about extending office hours. And doubtless, you've got your own ideas about the potential impact on your work. You're probably aware of the research pointing to the productivity benefits of flexible hours. This isn't in question, but of course, things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough tasks without having to worry about extra hours. Well, we've carefully planned things to prevent you from being swamped with work, interruptions, and so on. Employees will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Now look at question 27.
Mr. Smith seems a bit disoriented after his coronary bypass surgery. Will he be transferred to the step-down unit soon?
Yes, I'm about to request a transfer. He should be moved in about 20 minutes.
Okay. I've ordered some additional post-op cardiac biomarker tests. He may have complications related to myocardial damage. His heart was severely compromised. We weren't able to fully visualize the extent of the damage preoperatively, and we need to assess if any more of the myocardium has been affected by the procedure. He seems stable now, but I want his troponin levels checked every 6 hours. He needs to be observed for any chest pain, shortness of breath, and abnormal heart rhythms.
Okay, I'll make sure a note to watch out for myocardial infarction is forwarded.
Okay, if there's any change, call me.
Now look at question 28.
Today, we're going to start with Laura. She's 3 weeks post-surgery for an ACL reconstruction. She also had meniscus repair in her right knee. This is her first session in rehab post-surgery, correct?
Yes, that's right.
Okay, so today we're going to begin using a continuous passive motion machine to restore the movement in her right knee following the surgery. We're going to conduct each of her sessions this way, so you'll observe a progression over time, how we help her get back to her normal activities. Mobility is the key to recovery, and this method also helps stimulate blood flow, which should accelerate her healing process and alleviate her pain.
Now look at question 29.
If you look at the risks of community-acquired infections, they're really quite low compared to hospital-acquired ones. Clearly then, we can make the biggest difference in reducing risk and improving outcomes in our healthcare settings. Our antibiotic resistance rates here are actually below average. We're at 12% compared to around 20% nationally. The patients I treat tend to have compromised immune systems, so they're at higher risk. And when they're admitted, we don't have a lot of time to prepare them or to reduce potential risks. Maybe a day or two. In terms of patient safety, every hour, every shift we can use to implement infection control measures counts. That's because the patients we're dealing with are prone to developing resistant infections given their associated conditions like diabetes, lung, and kidney diseases.
Now look at question 30.
How are you feeling, Mrs. Johnson?
Tired, but the pain medication must be doing its job. I can't feel my hip, as you mentioned.
It's normal to feel fatigue after surgery. The operation went smoothly, though. We replaced the damaged part of your hip joint. You're cleared to go home now.
Oh, thank you. I had a hip replacement on the other side a few years ago, so I know what to expect. The fact that I can be mobile in just a day or two is still quite astonishing, though.
You'll need a walker for a couple of weeks, but you should be walking unaided within a month. Wait about 6 months before you do any strenuous activities, though.
6 months? After my last procedure, I started gardening again within 2 months. But now that I think about it, I guess I paid the price. That hip was troublesome for months afterwards.
If your body's giving you signals, it's important to listen to them.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
I'm joined today by Dr. Catherine Park, who works with patients dealing with the aftermath of severe strokes. Now, having a stroke is a frightening, life-altering experience for patients. Catherine, in your experience, how do patients react after the incident?
That varies widely depending on the severity of the stroke and the areas of the brain affected. One patient of mine, let's call her Linda, compared her stroke to a sudden, violent storm that left a path of destruction. Linda had been an avid piano player, and post-stroke, she struggled with losing the ability to play due to limited fine motor control in her hands. This is just one example. Every patient will have a unique journey and different challenges.
After a stroke, patients may experience something called phantom sensations. Can you explain more about this?
Yes, phantom sensations are a common occurrence post-stroke. These sensations can vary from tingling, numbness, or even feelings of movement in the affected limb when there is none. Like phantom limb pain in amputees, these sensations occur because the brain continues to receive signals from nerves that used to control the affected area. The severity of these sensations can vary greatly between patients and is often underreported due to fear of not being taken seriously.
I presume you've encountered this phenomenon in your practice.
Absolutely. I've had many patients who reported strange sensations in their affected limbs. Some feel as if their limb is floating or moving independently from the rest of their body. Others report feelings of heaviness, as though the limb were made of lead. In a few cases, patients have described a phenomenon known as telescoping, where it feels as though the limb is shrinking or retracting into the body.
I understand there's a new treatment trial happening at your hospital.
Yes, we're conducting a trial with a group of patients who've had debilitating phantom sensations for at least a year. Traditional treatments such as medications and physical therapy have been less effective for these patients, so we're exploring other avenues.
What approach did you take for this trial group?
We've been experimenting with a form of neurofeedback therapy. The patients wear sensors on their affected limb, which are connected to a computer. The patients are then shown a virtual representation of their limb on the screen. They're asked to try to move the virtual limb using their actual limb, which helps the brain reestablish connections to the affected area. Many patients have reported that their phantom sensations decrease significantly after these sessions.
Are there any other benefits to this kind of treatment?
Besides reducing phantom sensations, this method helps patients regain a sense of control over their bodies, which is invaluable in stroke recovery. Furthermore, patients can continue the treatment at home using a computer and a webcam. Our follow-up studies show a significant decrease in phantom sensations, and patients often report feeling more confident and positive about their recovery.
This is fascinating research, and we wish you the best of luck as it continues.
Thank you. It's an exciting field, and we're hopeful about what the future may bring for stroke patients.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, my name's Jay Cooper. I'm a dermatologist, and today I'd like to discuss a condition called atopic dermatitis, often referred to as eczema. Atopic dermatitis is a chronic, inflammatory skin disorder that is typically characterized by dry, itchy patches on the skin, which can become red, swollen, and sore. This condition is often mistaken for a simple rash, especially in its early stages. It usually appears in childhood, often before the age of 5, and tends to run in families with a history of allergies or asthma. Eczema is surprisingly common, affecting around 10 to 20% of children and 1% to 3% of adults worldwide. The exact cause of atopic dermatitis is still unknown, but it appears to be linked to a combination of genetic, environmental, and immune system factors. Those with the condition often have a damaged skin barrier, which makes the skin more susceptible to environmental triggers and allergens, causing inflammation and further barrier damage. While there's no evidence that food allergies cause eczema, they can trigger flare-ups in some people, especially children. Let me tell you about a case I encountered recently. A 35-year-old man named Mark came to see me with recurrent, intense itching and redness on his hands and arms. He had been dealing with these symptoms intermittently for over a year, often trying to manage them with over-the-counter creams and ointments. His previous diagnoses were contact dermatitis due to allergens in his workplace, but the condition persisted despite his efforts to protect his skin. After a detailed medical history and a few tests, we identified his condition as atopic dermatitis. It's critical to understand that living with atopic dermatitis can be quite challenging. The constant itchiness can lead to sleep disturbances and negatively impact the quality of life. Furthermore, visible symptoms can cause emotional distress, leading to feelings of embarrassment, anxiety, and even depression. While there's currently no cure for eczema, the focus is on managing symptoms and preventing flare-ups. Treatment plans typically include a combination of skincare routines, lifestyle changes, and, if necessary, medication. One of the most effective ways to manage atopic dermatitis is by keeping the skin moisturized. Regular use of emollients can help repair the skin barrier and reduce inflammation. Also, identifying and avoiding personal triggers, which could be anything from stress to certain fabrics or soaps, can help prevent flare-ups. Regarding diet, there's ongoing research into the effects of certain foods on eczema. Some people report that cutting out certain foods, like dairy or gluten, can help reduce their symptoms. However, this varies from person to person, and it's important to consult with a healthcare professional before making significant dietary changes. In conclusion, atopic dermatitis is a complex, chronic condition that requires a comprehensive, tailored approach to manage effectively. With the right treatment plan and self-care, many people with eczema can lead comfortable, healthy lives.